Federal government has expressed readiness to strengthen the country's rehabilitation service delivery system as part of effort to meet up with the World Health Organization Rehabilitation 2030 Agenda Initiative. The Minister of Health and Social Welfare, Dr. Tunji Alausa, made this known while speaking at the stakeholders meeting on implementation of Rehabilitation 2030 in Nigeria, organized by the Medical Rehabilitation Therapists Board of Nigeria in Abuja. The minister, who was represented by the Director of Regulatory Bodies and Professional Schools, Opipi Obapo, said the present administration is aware of the challenges as it affects the healthcare system and is keen to addressing and tackling the major health problems through various programs and initiatives that would improve the health delivery system.
You can be rest assured that the healthcare system will be turned around in Nigeria in no distant time with what the government of the day has begun. No time for details. This gathering represents an important step in the implementation of the Rehabilitation 2030 Agenda Initiative, which envisions that every citizen should be able to meet his or her rehabilitation needs. Your gathering today is a milestone for Nigeria in fulfilling its mandate to transform healthcare service delivery to assume universal health coverage.
Registrar of the board, Rufai Ahmed, and other stakeholders at their separate remarks stressed the need for federal government to take the resolutions and recommendations made by the board to reposition the nation's healthcare delivery system.
Confronting our government and indeed other governments around the world in implementing Rehabilitation 2030 agenda, for which reasons we are gathered here. A few of these challenges include inadequate multidisciplinary rehabilitation workforce, lack of a comprehensive structure for rehabilitation service delivery, regulatory processes that do not conform to evidence-based realities, lack of disability-sensitive, quality, basic, and continued education and training of health professionals, lack of comprehensive structure for rehabilitation service delivery, constraints in funding and budgetary release, limited integration of rehabilitation into the health sector and universal health coverage, limited expansion of health financing and enhancement of health information system.
That you continue to make much more impact in this country, and we shall support you. The WHO 2030 vision should not just be paperwork or rhetoric. I'm very convinced, because we've been having so many visions, Vision 220, 2020, 2030, 2015, they never took place. But what we are going to do today is not just talk, but do. I'm very convinced that we are moving forward, and that Nigeria has the vibrant people to move this nation forward.
But we believe that with this document and prompt adoption by the federal government, we believe quite a lot will be done in rehabilitation, especially as regards policies at the federal level, the state level, and the local government. Because if we don't have policies, definitely we won't have funding. So we are hoping that all this will be done and that the document is going to enjoy the support of the federal government and all the necessary agencies in Nigeria.
In Abuja, LM Chukwemeka reports.